pregnancy outcomes. The members of the group are Natalia, Nadia, Irina, and myself, Jorge. So today we are presenting the evidence linking periodontal disease and adverse pregnancy outcomes, such as preterm birth, low birth weight, preeclampsia, gestational diabetes, and pregnancy-associated pyogenic granuloma.
So periodontal disease overview. Periodontal disease is a chronic inflammation condition of the periodontal tissue. The bacterial biofilm provokes inflammation and tissue destruction, releasing systemic mediators into circulation. Did you know up to 70% of women experience some degree of periodontal inflammation during their pregnancy? So systemic overview and meta-analysis have demonstrated that women with periodontal disease have nearly double the risk of preterm birth and the increased risk of a low birth weight. However, more recent reviews shows that variability depends on the definition of disease and study design. Did you know that oral bacteria such as Fusobacterium nucleatum have been isolated from amniotic fluid and placental tissue in cases of preterm labor? Preeclampsia. A 2025 systemic review and meta-analysis reported that women with periodontitis have a 20% higher risk of developing preeclampsia. The proposed mechanism involves systemic inflammation and endotoxemia that may contribute to endothelial dysfunction. Did you know the inflammatory mediators release the periodontal disease, such as cytokines and prostaglandin, are the same molecules involved in inducing labor?
So, gestational diabetes mellitus, systemic reviews confirm that periodontal disease is associated with the increased risk of gestational diabetes mellitus, and chronic periodontal inflammation contribute to systemic insulin resistance. Did you know that gestational diabetes is one of the most common complications of pregnancy, and periodontal disease may be a modifiable risk factor for it? Do you know about plural gestation? Pregnancy with twins or more fetuses increases the risk of preterm birth, low birth weight, and cesarean section, and the babies are more likely to spend more time in the neonatal intensive care until after birth. Patient positioning in the dental chair may be difficult, and patient may experience more discomfort earlier in pregnancy. So, 6 questions most women have about oral health and pregnancy when they visit the dental office. So, the first question is it safe to have a dental visit while pregnancy? So, yes, in fact, it is recommended, and morning sickness and hormonal changes can make you more prone to gum disease and cavities when you are pregnant, which can impact your baby's health. A dentist can treat these problems or help you avoid them. And another question is, at what point in my pregnancy should I have a dental checkup? So get a dental checkup before your delivery. If your last visit was more than 6 months ago or you have any oral health issues, schedule an appointment as soon as possible.
Another popular question, what information should I tell my dentist about my pregnancy? Tell your dentist that you are pregnant and your due date. Also be sure they are aware of any medications you are taking, specific medical conditions, any form of tobacco or drug use, or if your pregnancy is high risk. What about dental treatments? Are they safe while pregnant? Yes. X-rays, local anesthetics, and most pain medication are safe as long as the dentist is aware of your pregnancy. What steps should I take to prevent oral health problems during pregnancy? Be sure to brush twice a day with fluoride toothpaste, clean between your teeth, get a dental checkup, and limit sugary foods. If morning sickness occurs, rinse your mouth with 1 tablespoon of baking soda in a glass of water. Why is my oral health important to my baby after she is born? Moms and babies share everything, including bacteria. If you have cavities, you also have the bacteria that cause them in your mouth. This bacteria can be passed from your mouth to your baby's mouth and increase her risk of cavities too. So it's important to get a dental checkup and establish a healthy smile before the baby is born.
So some of the resources that we have found for are important for pregnant women are Protect Tiny Teeth. This is a set of resources to help healthcare providers talk to their pregnant patients and new patients about the importance of oral health. And some other additional resources are the American Academy of Pediatrics and the American Academy of Pediatrics. They both have a toolkit for the providers and for moms as well. So this critical thinking question is, which of the following pregnancy outcomes have been linked to periodontal disease? And we have the options preterm birth, low birth weight, preeclampsia, gestational diabetes, and pregnancy-associated pyogenic granuloma. And the answer will be all of the above. Thank you for joining to this presentation and have a good day.